Hello student, welcome in today's session. Today's video, it is about the blood pressure. In last video, we have seen the external structure, internal structure, pumping action and the mechanism and about the blood vessel. You know that for the transportation and circulation of blood, an external force is necessary to movement of blood or the motion of blood. But that external force, it is provided by the SA node or the sinoauricular node and the AV node. When they are undergoes the contraction and relaxation, they provide the contraction to the cardiac muscles of the heart. And when heart chambers get contract, it provide a way of pressure, that is a way of contraction to the all parts of the heart. And that way of contraction reaches to the all parts of the body also. The way of contraction during the way of pressure, which is during the contraction of a heart chamber, that is nothing but the pulse. And pulse rate and heart rate, it is one and the same. What is mean by pulse? It is the way of contraction which is transported throughout the body, especially in arteries during the ventricular contraction. When ventricles get contract, a way of contraction, a way of pressure passes through the arteries, that is nothing but the pulse. And in a single minute, in 1 minute, that arteries having the 72 waves of a contraction, that is pulse rate, it is 72 pulse per minute, that is nothing but the heart rate. Therefore, pulse rate is equal to the heart rate. That pulse, it gives the arteries way of a contraction. Pulse rate and heart rate, it is one and the same. Pulse, it is feel in the main arteries, that is the radial artery of the hand, then the carotid artery which provide the blood to the brain or the nervous system, that is about the pulse. That means to movement of a blood, to motion of the blood, a force is necessary which is provided by SA node. But that force, it is a self-made by the blood. Blood, it having a force which provide the movement of a blood. And today we are going to learn about the blood pressure. It is the pressure exerted by blood itself. It is the pressure exerted by blood on the wall of arteries. Arterial wall face a pressure which is exerted by blood itself on their walls, and that pressure, it is nothing but the blood pressure. And for movement of a blood, for a transportation of a blood, for circulation of blood, that pressure is necessary. Otherwise, blood remains stagnant, stable at that place. And that pressure, it is exerted on the wall of arteries due to ventricular contraction mainly. Therefore, it is also defined as the pressure exerted by blood on the wall of arteries during ventricular systole or ventricular contraction is called as a blood pressure or BP. That blood pressure, it is measured in terms of columns of mercury. That mercury columnच्या height मध्ये blood pressure ला मोजल्या जातं. And a special device to measure that blood pressure, which is called as sphygmomanometer. The medicalच्या न्यू स्टुडंटला सगळ्यात आधी बीपीचं मशीन वापरायला शिकवतात. And BP, it is the one of the major point in every diseases, in every disorders of the body. It is to be measured. It get affected by the major points. Then it occurs during the ventricular systole. When the artery is having the blood pressure, it occurs during the ventricular systole or the contraction. And that blood pressure, it is divided into two main types, that is the systolic blood pressure and the diastolic blood pressure. What do you mean by the systolic blood pressure? That systolic blood pressure, it is the pressure exerted by blood on the wall of arteries during ventricular systole. It's called as systolic blood pressure. See that What is systolic blood pressure? It is the pressure exerted by blood on the wall of arteries during ventricular contraction or ventricular systole, called as systolic blood pressure. And that is 120 mm of Hg. किती असतं ते? 120 mm of Hg मर्क्युरी कॉलम मध्ये, मर्क्युरीच्या हाईट मध्ये. Then what is diastolic blood pressure? Diastole means relaxation of ventricle, the joint relaxation of all the chambers, auricles as well as ventricles, but especially ventricles because they have to pressurize more than the auricles. That what is the diastolic blood pressure? It is the pressure exerted by blood on the wall of arteries during ventricular diastole. When ventricle get relaxed, that time a pressure exerted by blood on the wall of arteries, that is called as diastolic blood pressure, and that is 80 mm of Hg in case of a height of a mercury column. बघा, जेव्हा वेंट्रिकल कॉन्ट्रॅक्ट होतात, राईट वेंट्रिकल लंग्सला ब्लड प्रोव्हाइड करतं पल्मनरी आर्टरीद्वारे आणि लेफ्ट वेंट्रिकल सिस्टमॅटिक आर्टरीद्वारे सगळ्या बॉडीला शुद्ध रक्त पुरवतं. त्यावेळी बॉडीच्या आर्टरीजमध्ये ब्लडद्वारे जे प्रेशर एक्झर्ट होतं त्याला आपण काय म्हणतो? दॅट इज कॉल्ड ॲज सिस्टॉलिक ब्लड प्रेशर आणि ते 120 mm असतं. जेव्हा वेंट्रिकल रिलॅक्स होतात, वेंट्रिकल रिलॅक्स झाले म्हणजे ऑरिकल्समध्ये सगळ्या बॉडीकडून ब्लड, अशुद्ध ब्लड मागवलं जातं. लेफ्ट ऑरिकलमध्ये लंग्सकडून शुद्ध ब्लड मागवलं जातं. दॅट टाइम अ प्रेशर एक्झर्टेड बाय ब्लड ऑन द wall of arteries during ventricular relaxation, that is called diastolic blood pressure. When ventricle get relaxed, a pressure exerted by blood on the wall of arteries, that is called as a diastolic blood pressure, and that is near about the 80 mm of Hg. And this ratio, it is called as a blood pressure. Blood pressure nothing but that ratio 120 about 80 mm of Hg. That ratio gives the BP or the blood pressure, and it is measured by an instrument that is called the sphygmomanometer, which works on the pressure of blood and external atmospheric pressure, that coordination between that pressure. And to that apparatus one mercury column is attached, and when that pressure get balanced, mercury column raised in that apparatus, and by which a pressure is calculated. Then this blood pressure is affected or by many factors. आता बघा, that the ratio it is 120 about 80 mm of Hg, and the difference between that 40 mm of Hg. याच्यामधला डिफरन्स हा कायम राहायला पाहिजे 40 mm of Hg. Blood pressure, it is one of the major point which gives the health of a person. A healthy person may affected by a small change in its BP. कुठल्याही आजारामध्ये सर्वात पहिलं लक्षण काय चेक केलं जातं? What is the normal blood pressure? And the normal blood pressure in an adult, it is about the 120 divided by 80 mm of Hg. Then many factors they are affecting on the blood pressure. खूप सारे फॅक्टर आहेत जे ब्लड प्रेशरवर अफेक्ट करतात. वन ऑफ द मेन फॅक्टर इज, याच्यामध्ये नाही लिहिलेलं आहे मी, दॅट इज द पेरिफेरल रेजिस्टन्स ऑफ द arteries. Arteries having, when any fluid runs through a channel, runs through a tube-like structure, that the vessels or the pipe-like structure exert a pressure over that movement of that fluid. त्या फ्लुइडची मुवमेंट आहे, ते फ्लुइड त्या पाईपच्या वॉलवर किंवा ट्यूबच्या वॉलवर, सपोज आपली आर्टरी त्याच्यावर एक प्रेशर क्रिएट करते, पण सेम अपोजिंग प्रेशर इट इज ऑल्सो एक्झर्टेड बाय दॅट वॉल ऑफ अ ट्यूब, दॅट वॉल्स ऑफ अ आर्टरीज, आणि दोन्हीकडून सेम प्रेशर एक्झर्ट होत आहे. आता जेव्हा ब्लड फ्लो एक प्रेशर एक्झर्ट करतो ऑन द वॉल ऑफ आर्टरीज, दॅट टाइम अ प्रेशर एक्झर्टेड बाय द आर्टरीज ऑन द ब्लड ऑल्सो. म्हणजे ब्लड करून आर्टरीजवर जसं प्रेशर एक्झर्ट होतं तसं आर्टरीच्या वॉलकडून कुणावर प्रेशर एक्झर्ट होतं? ब्लडवर सुद्धा. अँड दॅट इज कॉल्ड ॲज अ पेरिफेरल रेजिस्टन्स. पेरिफेरी मीन्स द टोटल सर्कमस्टान्सेस ऑफ दॅट आर्टरी, अँड दॅट आर्टरी हॅव्हिंग ऑल्सो अ एक्झर्शन ऑफ अ ब्लड प्रेशर ओव्हर दॅट blood, and that is called peripheral resistance. Suppose that vessel's diameter, it is also affect on the blood pressure. If vessel diameter it is get decreased, when vessel diameter it get decreased by the formation of a ADH, antidiuretic hormone, that if there is a production of ADH hormone, it will decreases the diameter of the blood vessel, and that during the renal failure, during the nephritis, inflammation of a nephron, in the kidney problems, that vasoconstrictor ADH is secreted to maintain the glomerular filtration rate. किडनीचा जो फिल्ट्रेशन रेट आहे तो मेंटेन करण्यासाठी वेसल्सला कन्स्ट्रिक्ट करण्यासाठी कॉन्ट्रॅक्ट करण्यासाठी एक हार्मोन तयार होतो, दॅट इज द ADH. अँड ADH डिक्रीजेस द डायमीटर ऑफ वेसल. आता वेसल्सचं डायमीटर डिक्रीज झालं की काय होतं, दॅट पेरिफेरल रेजिस्टन्स इज इन्क्रीजेस अँड इट विल डिक्रीजेस द ब्लड प्रेशर. आता बघा, पेरिफेरल रेजिस्टन्स इन्क्रीज झालं की ब्लड प्रेशर डिक्रीज होतं, पेरिफेरल रेजिस्टन्स डिक्रीज झालं की ब्लड प्रेशर इन्क्रीज होईल आणि पेरिफेरल रेजिस्टन्स इन्क्रीज झालं की ब्लड प्रेशर डिक्रीज होईल. दॅट मीन्स पेरिफेरल रेजिस्टन्स अँड ब्लड प्रेशर दे आर इनवर्सली proportional to each other. Then they are not directly proportional. If one factor is increases, another factor automatically decreases. If that peripheral resistance increases, it having a more value, then the blood pressure or the arterial blood pressure it is get decreases. When peripheral resistance decreases, arterial blood pressure increases. If that vessel's diameter it is less, then blood pressure increases. If vessel diameter get more, blood pressure that decreases. Then again the factors affecting on the blood pressure, that are first one, cardiac output. Our normal cardiac output it is the stroke volume into the ventricular output. Then that it is about the 5.040 ml, means near about the 5 liter. If any change in the cardiac output, it will affect on the blood pressure. That means blood volume, if it is get increases, then there is an increase in blood pressure. If blood volume get decreases, it will decrease in the blood pressure. Then the length and diameter of the vessels. Also one of the factor it is important, that is if the vessel's length and diameter it is affecting on that blood pressure. If diameter is decreases, blood pressure increases. Diameter increases, blood pressure decreases. That means it is inversely proportional to each other. That if there is any injury to the body, that time a relaxation hormone it is produced, that is the histamine, which also dilate the blood vessel. When blood vessels dilate, then blood pressure decreases. When blood vessels contract, blood pressure increases. Means when diameter decreases, blood pressure increases. When diameter increases, blood pressure decreases. Then next factor, that is the diet. If we are having the more fatty diet, we are having the oily diet, then our blood pressure is increases with that diet. That means our transportation or circulatory system needs the fibrous diet, needs the proteinaceous diet. Then next, the viscosity. If the viscosity of blood it is increases, then automatically the blood pressure also get increases. Viscosity of blood it is increases by the formation of a fatty substance or the production of fatty substance in the blood, that is चिकटपणा ब्लडचा जो म्हणतो आपण. Viscosity of blood directly proportional to the blood pressure. Viscosity increases, blood pressure also increases. Viscosity decreases, blood pressure also decreases. Next, that is the age. With the increase in age, blood pressure get increases, and above 45, above 50, much people face the problem of a blood pressure, that is called as hypertension, and people regularly take the pills for that blood pressure. And it is due to many factors. Females having somewhat low blood pressure than the males before the menopause. But after the menopause, females also facing the same problem like the males. They are also having the high BP as compared to the comparative age of their males. Then that means with the age, our elasticity of artery get decreases. Our metabolic rate also get decreases, and it affects on the blood pressure. Next, that is the gender. Male having the higher BP than the female. Then exercise, anxiety, and the emotions, anger, fear. In this condition, blood pressure get increases to maintain our body metabolic rate. that during exercise, heavy exercise, blood pressure increases to provide the efficient blood flow to every visceral organ to the body. Then the sleep. During the that having the horizontal position of body, आपण जेव्हा आडवे होतो म्हणजे झोपतो तेव्हा काय होतं, BP get normals or lower than the normal. And during the emotional stress, anxiety, fear, exercise, during this condition the BP get increases. These are the many factors which are affecting on the blood pressure. Then that what are the causes of blood pressure? Again, age, it is one of the main cause of that blood pressure. Again, diet, it is one of the main cause of blood pressure. But scientifically two main causes are there, that is our artery having the normal elasticity to contract and relax properly, and due to the SA node, due to the vagus nerve, due to AV node, and due to the arterial elasticity, our heart and circulatory function normal. But when artery get hardened means it loses its elasticity, and loss of elasticity of artery or hardening of artery, कडक होते artery म्हणजे तिची नॉर्मल कॅपॅसिटी आहे इलास्टिसिटीची कॉन्ट्रॅक्ट आणि रिलॅक्स करण्याची, ती लॉस होते, and that term it is called as arteriosclerosis. Arteriosclerosis means loss of elasticity of artery or hardening of artery, called as arteriosclerosis. And if artery is unable to contract and relax properly, it do not provide the blood to heart, it do not provide blood to all parts of an organ, and it having a great effect on the heart function. When the veins carried out the total volume of blood to the heart, that is called as venous return. The total volume of blood provided by the veins to the heart, that is called as venous return. That is maybe a deoxygenated or oxygenated, and the venous return also having the greater effect on the blood pressure. If venous return decreases, it also decreases the blood pressure. It also affect on the cardiac output. आपल्याला माहिती की ब्लड प्रेशरशी कार्डियक आउटपुट खूप रिलेटेड आहे. म्हणजे आपलं टोटल व्हॉल्यूम ऑफ ब्लड जे 5 लिटर आहे त्याच्यावर त्याचा ब्लड प्रेशरवर आणि त्याचा परिणामी वेनस ब्लड रिटर्नवर पण खूप परिणाम होतो. देन अगेन वन ऑफ द टर्म रिलेटेड विथ द ब्लड प्रेशर मेनली, that is the atherosclerosis. Please differentiate between these two terms. Arteriosclerosis, hardening of artery. That if R is present, hardening. T is present, deposition of fat. That deposition of fat, cholesterol in the lumen of artery. If a tube-like structure, that is called as artery in the circulatory system, if a cholesterol or fatty substance it is deposited inside the lumen of that artery, its diameter get decreases and the blood having a more pressure on the wall of artery during traveling through that narrow lumen. मध्ये काही साचलं ब्लड वेसलमध्ये तर आपोआप ब्लडला वाहायला जागा कमी लागते आणि त्यामुळे त्याचं प्रेशर वाढतं वॉल्सवर. दॅट इज कॉल्ड ॲज अ डिपोजिशन ऑफ फॅट, that is called as atherosclerosis. And due to atherosclerosis, arteries losing their elastic capacity and they lost the control of contraction and relaxation. There is a many plaques are formed which is of a cholesterol and blood having a more arterial blood pressure on the walls of a artery. Then if that blood pressure it is decreases below the normal, that is 120 about 80 mm of Hg. If systolic blood pressure it is decreases about 90 from 120, 120 से 90 झालं, and diastolic blood pressure it is decreases up to 60, then it is called as a hypotension, lowering blood pressure. That when systolic blood pressure decreases up to 90 and diastolic blood pressure decreases up to 60, that when BP is about 90 divided by 60 mm of Hg, it is called as hypotension, low होतं blood pressure. And what is hypertension? When systolic blood pressure raised to 140 and diastolic blood pressure raised to 80, that means there is increase in blood pressure by 20 about 10 mm of Hg. म्हणजे वरचं ब्लड प्रेशर सिस्टोलिक ब्लड प्रेशर 20नी वाढतं आणि डायस्टोलिक ब्लड प्रेशर 10नी वाढतं आहे, तर त्याला आपण काय म्हणू, दॅट इज कॉल्ड ॲज हायपरटेन्शन विच इज अबाउट 140 अबाउट 90 mm of Hg. Then normally the BP increases with the age due to that loss of elasticity in the artery. एजच्या नुसार आर्टरीची इलास्टिसिटी लॉस्ट होत जाते आणि BP काय होत जातं, वाढत जातं. हायपरटेन्शन इट इज आयदरली कॉल्ड ॲज, इट इज ऑल्सो कॉल्ड ॲज हाय BP, हाय ब्लड प्रेशर. अँड विथ दिस ब्लड प्रेशर वन ऑफ द फॅक्टर इज रिलेटेड, दॅट इज द पल्स रेट किंवा पल्स आपण म्हणू. When there is exertion of blood pressure, that time a wave of pressure, it is travel through the arteries. That wave of pressure is nothing but the pulse, नाडीचे ठोके आपण म्हणतो. And that pulse rate, it is equal to the heart rate, means 72 waves of contraction it is travel through the artery in a single minute. That pulse rate, it is 72, which is equal about the heart rate. It feels in the main arteries, that is the radial, femoral, carotid, and that pulse gives the idea about the blood pressure. That means today we will learn the pulse and the blood pressure. Blood pressure nothing but the pressure exerted by blood on the wall of arteries, especially during the ventricular contraction. But during the ventricular contraction, pressure is called as systolic blood pressure, and during the relaxation it is called as diastolic blood pressure. This ratio is nothing but the BP or blood pressure, and it is measured in terms of sphygmomanometer. Then it is affected by many factors like the cardiac output, gender, length and diameter of vessels, peripheral resistance, venous return, exercise, diet, viscosity of blood, age, sleep, emotion, anxiety, many factors affecting on the rate of that on the blood pressure. That it is the main causes of blood pressures are hardening of artery or loss of elasticity of artery, that is called arteriosclerosis. Arteriosclerosis, when artery get hardened, जाड होते, गच्च होते. And when there is a deposition of cholesterol or fatty lipid substances in the lumen of artery, it decreases the diameter, it is nothing but the atherosclerosis. And that plaques, तो जो भाग जमा होतो त्याला आपण म्हणतो atherosclerotic plaque. And when BP decreases below the normal, that is called hypotension. When BP increases above the normal, that is called as a hypertension. Hypertension is 90 to 60 mm of Hg, and hypertension is 140 to 90 mm of Hg. The normal BP is 120 by 80 mm of Hg. The difference is 40 mm of Hg, means blood pressure is measured in terms of height of mercury column by sphygmomanometer. This is the brief idea about the blood pressure and the factors affecting on the blood pressure, then systolic, diastolic blood pressure, and the main causes of blood pressure. That's all for today's video. Thank you for today's video.